Hi everyone, myself Prabhakar, Associate Professor, Department of Pharmacology. Today we'll discuss about NSAIDs, that is nothing but non-steroidal anti-inflammatory drugs. So, non-steroidal anti-inflammatory drugs (NSAIDs) are a class of medications that provides analgesic, antipyretic, and anti-inflammatory effects without they having the steroidal structure. They primarily inhibit the cyclooxygenase enzyme, thereby reducing the synthesis of prostaglandins, which are known to be the key mediators of inflammation, pain, and fever. So, generally, they are used in several conditions like rheumatoid arthritis, osteoarthritis, musculoskeletal pain, dysmenorrhea, headache, post-operative pain, and fever. Based on their selectivity, they can be classified as non-selective COX inhibitors as well as the COX selective COX-2 inhibitors. So, although they have highly effective energy associated various adverse drug reactions like gastric irritation, peptic ulceration, renal impairment, and increased cardiovascular risk, especially with the long-term use, and also hepatic uh, dysregulation. So proper selection and monitoring before usage is essential for the clinical practice. Next, we have the classification table. So the drugs are the mechanism based on the pharmacological action. We are classifying the drugs. So analgesic plus antipyretic and anti-inflammatory drugs are diclofenac, indomethacin, naproxen, piroxicum. Next, we have analgesic plus weak antipyretics. Sorry, antipyretics with weak anti-inflammatory drugs. They are Brufen, mild dose with mefenamic acid, and predominantly analgesics, which are known to be treatment of post-operative as well as severe pain, ketorolac, and then antiplatelet action with the mechanism of irreversible COX inhibition, that is aspirin at low doses. And next we have the selective anti-inflammatory COX-2 selective drugs, nothing but celecoxib, etoposib, and we have which has having the uricosuric acid action, that is the aspirin. So next we will discuss about the detailed mechanisms of various NSAID drugs. First one we have the aspirin, which is known to be analgesic, antipyretic, and anti-inflammatory drugs. The detailed mechanism is that it acetylates the cyclooxygenase enzyme, leading to the irreversible inactivation of prostaglandin synthesis, leading to the decreased conversion of arachidonic acid and decreased levels of PGG2 and PGH2 formation, leading to decreased prostaglandins and thromboxane A2 levels. The final effect is platelet activation for the entire lifespan of 7 to 10 days. So, with this help, it produces the analgesic as well as the antipyretic with the anti-inflammatory and antiplatelet actions. Next, we have the Brufen, ibuprofen generally, and also diclofenac drugs. So they act through reversible inhibition of prostaglandin synthesis and a decreased arachidonic acid metabolism and a decreased prostaglandin E2 at peripheral tissues, leading to the decreased sensitization of nociceptors to produce the bradykinin and substance P. Once the substance P level is reduced, the pain transmission is decreased and decreased PG mediated vasodilation also. And also the edema is reduced and PGE2 in hypothalamus is reduced, leading to the decreased thermoregulatory set points. So then it produces the analgesic, anti-inflammatory, and antipyretic effects. Next, we have the indomethacin. So it's a potent inhibitor of prostaglandin synthesis, decreased inflammatory prostaglandins, leading to the decreased leukocyte chemotaxis and decreased cytokine amplification with the help of IL-1, that is nothing but interleukin 1, and tumor necrosing factor alpha. It reduces the vascular permeability, leading to strong anti-inflammatory effects. Next, we have the ketolac, which is a potent analgesic used for the operative as well as surgical pain management. We have a COX inhibition as a mechanism here, so decreased, marked decrease in PGE2 levels in peripheral nerves, and decreased nociceptor activation and decreased central pain signaling. and have minimal effect on inflammatory cell migration. Next, we have the recent drugs, meloxicam or nimesulide, and we have silicosip as well as etoposide. These drugs have similar mechanisms as we discussed earlier. So let us discuss one by one. So first one is meloxicam or nimesulide. So nimesulide, it's act inhibition of inflammatory prostaglandin production, decreased PGE2 at the inflammatory site, and decreased vasodilation, and it decreased plasma oxidation, leading to decreased sensitization of peripheral pain receptors. By these mechanism, it produces the anti-inflammatory as well as analgesic effect. Next, we have the silicosip as and the etrosip. These drugs inhibits the inducible prostaglandin synthesis at the inflammatory sites. So generally, they are acting anti-inflammatory sites only. So leading to the decreased prostaglandin mediated endothelial dilation as well as decreased inflammatory hyperemia and also decreased nociceptor sensitization with minimal interference with gastric cytoprotective prostaglandins. So, by all these effects cumulatively, it produces the anti-inflammatory with reduced gastric irritation. So, among all these NSAID drugs, this is the only drug with reduced gastric acid secretion. So final thing is we have to know the important adverse drug reactions of NSAIDs, which is very important for various competitive exam aspects. First, we have to know the aspirin. Aspirin is known to cause gastric ulcer, GI bleeding, prolonged bleeding time, tinnitus, and Ray's syndrome. Next, we have the brufen. So, brufen is known to cause gastritis, nausea, mild renal impairment, and fluid retention. Next, we have the diclofenac. So, it produces the hepatotoxicity as a predominant effect. Next, we have GA ulcer, increased cardiovascular risk. And then indomethacin with the severe gastric irritation, headache, dizziness, and CNS confusion. And then we have ketolac, GI bleeding, and renal toxicity is known to be the ideas of ketolac, the potent post-operative pain management. Next, we have the naproxen with the gastritis and dyspepsia followed by fluid retention. And then piroxicam, known to cause peptic ulcer as well as photosensitivity. Next, we have silicosip, which is known to cause risk of myocardial infarction and hypertension. And the final two drugs are etoposide with various cardiovascular events as well as edema. Meloxicam is known to have GI discomfort because it reduces the GI secretion and also sometimes it may lead to renal impairment. So these are the various adverse drug reactions known to cause by non-steroidal anti-inflammatory drugs that we have to remember. Okay, so with this note, we are going to conclude the NSAID drugs. Thank you.